The COVID-19 pandemic was eye-opening for Canadians who hadn't thought too much about our healthcare system. In the early days, the system buckled under enormous strain. Now, our healthcare workers are nearing exhaustion, and the backlogs of surgeries and diagnostic tests is growing and growing. The costs and consequences on provincial budgets and Canadians' health is significant. Living next door to the United States, which has a costly system producing uneven results, may have made us complacent about our own. Our political debates confuse the idea of universal access with Canada's current single-payer model. But around the world, dozens of countries have universal healthcare systems that outperform and cost less than the Canadian one. Take the Netherlands. The Dutch system is universal because everyone is required to have insurance. The country ensures equity by requiring open enrollment for all plans and providing generous government vouchers to help people pay their premiums. These plans then compete against each other, forcing them to be agile and adaptable. As the population ages in Canada and elsewhere, healthcare systems will need to adapt to people's changing needs. According to a recent C.D. Howe Institute report, this competitive model is better positioned for this than a single-payer system like Canada's, where all decisions are heavily dependent on politics. As another example, Japan's healthcare system is known for great outcomes compared to other universal systems. Japan's system is very different from Canada's, relying on an insurance system with more than 3,500 insurers to provide health care to the entire population. The results in Japan are impressive. Total spending, as a share of the economy, is almost half of Canada's. Compared to Canada, survival rates from some cancers are higher in Japan. Infant mortality rates are half what they are in Canada, and there are nearly 3 times as many hospital beds available. The United Kingdom is a good example of how reforms can help a single-payer system. In 2003, England introduced a new funding scheme for healthcare providers that provides incentives to improve performance. In 2006, every patient was given the freedom to choose their hospital for secondary care, creating financial incentives for providers to improve their clinical performance. Now, the UK spends less on healthcare as a share of GDP than Canada and provides more physicians and much shorter wait times. There's room to learn from these experiences and improve Canadian health outcomes without sacrificing the principle of universality. For instance, Maria Lily Shaw, a researcher at the Montreal Economic Institute, recommends starting with digitizing patient health records and adopting payment mechanisms that encourage performance, efficiency, and productivity. That's just one example of how studying other countries' approach to universal healthcare can help us reform our system and fix the deficiencies exposed by the COVID-19 pandemic.